Ladies and gentlemen, can I request you all to welcome Mr. Ajay Seth, who is the Innovation Portfolio Manager at Philips Innovation Campus, to deliver the next keynote on improving and simplifying quality of life using health tech products. Ajay, the stage is all yours.
Hi friends, pleased to be here having an opportunity to talk about how can we simplify and improve our life using health tech products. If we look at healthcare as a holistic view globally, there are 4 trends that are driving healthy living and healthcare overall globally today. First is really about chronic diseases and the rise of it worldwide. Second trend that you will see is the healthcare systems are under tremendous pressure to deliver care to more people and at a lower cost. I'm sure during COVID times, all of you have experienced some form of crunch with regard to either oxygen concentrators or the need for ICU beds. That underscores the healthcare pressure that is being felt globally per today. Also, people are increasingly wanting to take control of their own health. Mobile health has really changed how we consume information, and a complete category called mHealth has taken form and shape. And lastly, we see digitization all around us, which is producing data at an exceptional rate. And what can we do about it is something we will also talk a bit about. Zooming into these 4 trends, if we look at the chronic diseases that are on the rise worldwide, 1 in 3 people globally will be diagnosed with cancer through their lifetimes. Roughly 400 million people globally have diabetes, and about 500 million people suffer with respiratory diseases, and more than 1 billion adults have hypertension. If we bring it a bit closer home, India has 2 of the biggest burdens. We are the world capital for diabetes, and the second biggest disease burden for the country is the respiratory disease COPD. So the chronic diseases, while they are rising globally, 2 of the biggest challenges are also closer home within India. Healthcare systems are under tremendous pressure. Global health expenses are rising tremendously. Also, the amount of skilled workers who are trained healthcare professionals is not catching up to the extent that it should be. And by 2035, we will have a deficit of about 12.9 million globally. Also, there is a demand to actually reduce healthcare cost. I mean, while world is still talking about universal coverage for healthcare, many countries, including India, have an out-of-pocket expense which is pretty huge if there is a chronic ailment or a severe illness that a family or a person is faced with. Lastly, given all these trends, the healthcare professionals also are burning out, working 12 to 16 hours a day in ensuring that the health is delivered. Like we talked about, people are increasing wanting to control their health themselves. And with the penetration and improved connectivity, we see the healthcare revolution all around us via mobile phones that we carry. Roughly 52% of people use digital health technologies or mobile health apps to track their health indicators. And finally, this leads to an exponential growth in health data, which is what we can use to actually solve some of the healthcare challenges through health tech. Some of the sources of data remain personal health tracking devices, medical imaging, patient monitoring, home monitoring kind of devices. So starting from home to hospital, we see many devices actually producing data. And as per one estimate, in 2020, we had more than 2,000 exabytes of data that was generated just by the health tech community and the healthcare devices. Now, bringing it closer to the topic today, what does simplifying and improving quality of life means? I'm sure no one likes to be sick. No one wants to watch their loved ones suffer. Fear of unknown and aging is quite frightening as well. So can health tech deliver achieving first-time right diagnostics for better health outcomes, improving patient experience, improving staff experience, and even lowering cost of healthcare? I think 5 trends, that are shaping our environment today have the promise of delivering on the quadruple aim that we just saw on the previous slide. And we will examine them in a bit more detail going further. But these trends are really telehealth and virtual care, improving access to care due to digital, home becoming more and more the epicenter of care delivery, providing clinical decision support using AI with the huge amount of data that we have. And last but not the least is the consumerization of healthcare around us. Let's look at the first trend, which is really around telehealth and virtual health. In March 2020, when COVID broke out, I'm sure this is a moment that has been etched in all of our memories, and we will never forget this time for the rest of our lives. When the COVID pandemic broke out, uh, people were referring to Spanish flu as one of the anecdotal uh, historical moments to which we can draw some inspiration with. But we need to remember this was the first pandemic of the digital era, which meant that the approach and ways to solve it were completely different, and only limited learnings from the past could be taken into account. Having said that, there were 7 challenges from a patient's point of view that all of you might be able to relate with. And virtual care actually was able to easily resolve 4 of them. First one is due to a virtual environment, there is a reduced risk of exposure. Um, there were elective treatments that people had, and due to the exposure risk, nobody was visiting hospitals, which meant that telehealth could help continue the treatment via virtual mode. Virtually, it means that the cost of consultation, the time to travel, the cost spent for traveling, etc., is all taken out, which means that it makes it a lot more affordable to talk to a physician or get a consultation offline. And also payers got a chance to get a lot more information and data because newer digital tools were applied to. So in short term, there was an improved or an enhanced access to care that was provided as an alternative to physical world through telehealth or through virtual possibilities. Second thing that we will see going forward is the improved access to care. Taking an example from India, the National Digital Health Mission, which basically wants to create a national digital health ecosystem that will support universal health coverage, is being put into practice. Elements of it we already saw during COVID time, where there was an excellent way to actually track the vaccinations throughout the country and roll out a vaccination of massive proportions, which nobody in the world has actually seen so far. We will see data being liberated. Today, most of the data is sitting within hospitals, locked out. And in many cases, it is actually in pen and paper and physical form. With access to care infrastructure coming into place, we will see data ownership moving to patients, as well as data being liberated for means and purposes which can serve humanity within the country at a national level. This will foster interoperability. The information will now be able to move from one hospital, one physician to the other, also without the need for repeating scans and tests, which today, again, adds to the overall burden on healthcare as well as the cost of healthcare. The systems will prompt moving from a volume-based care to a value-based care. By this, what we mean today is doctors are basically incentivized, or health systems and healthcare providers are incentivized on delivering of care and not yet on the outcome of the care. But with data being transparently indicating what was done, how it was done, and what were the outcomes, there would be new possibility to start benchmarking the best in class and incentivizing based on the best in class standards that could be set out. And this will be a huge game changer for easing out the healthcare burden globally as well as within India. And lastly, interoperability we spoke about. This basically comes with certain standards. And because the data will have to live in an ecosystem, it will also force us to adopt a certain set of standards, which will ensure that information exchange can become a lot more easier. The third trend that we will see happening is home becoming the epicenter of care delivery. Our homes today are already epicenters of our life. I mean, things like working from home, being entertained, enjoying a sumptuous gourmet meal are all possible due to COVID sitting at home. And this trend has only increased or been accelerated because of the pandemic. Now, this being applied to healthcare means that we could see critical care patients who may just have had elective surgeries can now actually come home and recover rather than the need for them to stay at home because of the improved connectivity and the improved devices that we see in the health tech ecosystem, which are able to accurately real-time provide information back to care providers and the hospitals. The fourth trend that we will see is around clinical decision support through AI. We just saw that there is vast amounts of data being produced by the health systems, and this data will eventually get integrated into providing a more definitive diagnosis underpinning the clinical decision that trend talks about. Optimize the operational performance to ensure consistent quality of care. Simplify and automate the workflows to reduce staff burnout, variability in care delivery, and it will also bring in precision diagnosis as well as precision care towards the masses. The fifth trend that we see, and I'm sure this is something all of us can relate to again, is the consumerization of healthcare. Consumer and healthcare words are basically colliding, and they're colliding very fast. Consumer devices at home support professional body temperature monitoring, body mass analysis, and ongoing measurements of wide range of health biometrics, including heart rate, activity, sleep pattern, you name it, today is being collected as data. With secure connectivity, this data is ingested into health tech systems for a continuous monitoring, measuring, and then motivating people or patients to actually take action. Virtual coaches, like an example there of a toothbrush, a connected toothbrush, which can exactly tell you which parts of the mouth have you brushed, which parts have been left out and need a touch-up, what is the pressure that is being applied by a person on the teeth and whether that's optimal or the pressure should be reduced, so on and so forth. And it is able to curate data and collect data and over time also improve overall healthcare. Similarly, gone are the days when people had to visit clinics and hospitals for professional hair removal treatments, which were laser-based. Now there are home-based devices with a professional coach on the phones, which can tell you the rhythm and the period in which the hair removal laser devices need to be applied, how they need to be used, and providing a complete ease of use at home. During COVID times, I'm sure all of you may have been wanting to get oxygen at home. There was a huge demand for this device that you see in the middle, which is nothing but an oxygen concentrator. It pulls out pure oxygen from air and delivers at 5 or 10 liters per minute. Like things like these and more are more and more moving into our homes, and we will see this trend only increasing. If you also see medication, so once there is a chronic disease diagnosed, people need to be on lifelong medications, and medication adherence is one of the challenges that almost everybody faces in a longer duration. Reliance picking up NetMeds and actually providing space for the pharmacy within their Reliance stores is another trend that you see fastening medication or pharmacies getting into a consumerization aspect as well. So we will see more such things happening in the ecosystem. But one thing is for sure, that healthcare is no more bound within the realms of the hospital, and the consumerization of health is basically bringing health towards people's homes faster than we think. Finally, I think we are moving towards an era where we will be able to see a digital clone of ourselves, which will be able to help predict future issues, as well as provide for precision diagnosis and as well as precision treatment. And that's an era that we are soon heading into. Thank you very much.
Thank you, Ajay, for the insights. And I definitely hope that the healthcare sector will help us receive improved care, simplified lives at affordable rates.